Welcome back here on Live Impact News on WCNT Plus. I'm Nick Sturdivant. So before we went to break, we got an update on the flu strain, what you need to do to keep safe. In the upstate of South Carolina, they're dealing with, and they have been dealing with, a measles outbreak that continues to spread. Those numbers continue to go up. So yesterday, we got an update from the South Carolina Department of Health on those measles on that measles outbreak there in the upstate and across the state. Let's take you there now in case you missed it.
I'll leave things off to Dr. Bell now.
Casey, thank you. I'm having a few technical problems this morning. Are we okay with the audio?
Yep, sounds good. And your camera's on as well.
Okay, thank you so much. And good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health reported 20 new cases of measles in the state since Friday, which brings the total number of cases in South Carolina related to the Upstate outbreak to 176, and the total number reported to DPH this year to 179. 7 of the new cases were known household exposures, 5 resulted from a previously reported school exposure, 2 resulted from an exposure at church, and 1 resulted from an exposure at either school or church. The sources of 4 cases are unknown and still under investigation. And all of the new cases are Spartanburg County residents. In total, there are currently 287 people in quarantine and 2 in isolation. The latest end date of quarantine for these is January the 21st, meaning that we expect to continue to see cases well into January. Complications from measles are not reportable, but we have learned that 3 people with measles required hospitalization for complications. Both adults and children were involved. And to protect privacy, we do not provide personal details or specifics of clinical outcomes or the status of these cases. DPH encourages those potentially exposed to notify a healthcare provider of a possible measles exposure before seeking care, to allow arrangements to be made in clinical settings to protect others, as clinical settings have been settings where public exposures have occurred. One of our priorities is protecting the public from preventable exposures by implementing quarantine measures to help stop the spread of measles. So it's very important for those who have, even mild illnesses or who are in quarantine to stay home to protect others because they may not be aware that they can spread the disease. Vaccination continues to be the best way to prevent measles and to stop this outbreak. And we know the vaccination status of 170 of the 176 outbreak-related cases, and 99% of them are unvaccinated. So this speaks to the protection that vaccination brings as the best way to protect people against measles, to prevent ongoing spread in our communities, and to stop this outbreak. We remind people that vaccines are available at many primary care providers' offices and pharmacies, as well as at DPH Health Department clinics. And any community partner or organization interested in scheduling a vaccination event from DPH's mobile health unit can request a visit to their location by completing the form found on the DPH website. And with that update, I will turn it over to questions. Thank you very much.
Thank you, Dr. Bell. And everyone, I think most of you know the drill, but if you don't mind raising your hand, we'll call on you in the order you raise your hand in. And if you don't mind, when you do ask your question, to say your name and the name of the outlet you work with. And it looks like Tom's got a question. Tom?
Hi, Tom Corwin, Post and Courier. So earlier this week, DPH also put out the status of outbreaks of other vaccine-preventable viruses in the upstate. A number of outbreaks of pertussis, whooping cough, of measles as well. Does this, I think, add to the point about the need for vaccination?
It does add to the importance of vaccination, because we are seeing in a higher number of vaccine-preventable disease outbreaks in the upstate. which is an area of our state that has among the lowest vaccination coverage. So as we would expect with lower vaccination coverage for other vaccine-preventable diseases, we are seeing higher rates of varicella or chickenpox or pertussis and whooping cough, as you mentioned. This raises concerns for the flu as we are moving into widespread flu transmission in the state. And so, yes, this is a concern not just for measles, but we have a number of vaccine-preventable diseases that people could be protected against if we were able to get our vaccination coverage up more widely.
Thank you.
Thank you. And Mackenzie?
Hi, Mackenzie Musket, Spectrum News. I just wanted to pivot to the flu for a second. I know today the CDC bumped up South Carolina as having a very high activity level. And I know today Prisma Health and some other hospitals aren't letting children visit their hospitals. So how worried should people be about the flu this season? And how is this going to affect children now that we're seeing a measles outbreak and a very high widespread flu season?
Well, we're not asking people to be worried. We want people to be prepared and we want people to be informed. And so it is important information to know that influenza activity in the state is now widespread for 2 consecutive weeks. We want people to be informed that the vaccination against the flu is recommended for everyone 6 months of age and older, unless they have a contraindication every year, because this is what gives people the protection from the vaccine that's developed to be well matched against the most commonly circulating strains. We want people to be aware that with flu activity now on the increase, if they choose to get vaccinated, it actually takes about 2 weeks for the body to mount a immune response that is strong enough to protect them against flu infection or complications from the flu. And so those are all points that we want people to be aware of. This is an opportunity to be prepared. We can't anticipate when an exposure might occur, and so vaccination now will protect people throughout the flu season that we define as beginning in October and moving well into the spring. We continue to see flu activity as late as March and April, and we can see from one season to the next, it's unpredictable how severe the flu season might be. But an important point I want to make is regardless of the severity of the flu in each season, we see hospitalizations and deaths from flu, even in relatively mild seasons. So we want to encourage people to be aware of that and to get protected now.
Thank you, Dr. Bell. Peyton?
Hi, yeah, Peyton Furtado, WYFF News. Linda, we talked yesterday about the flu, but today we're talking about measles. We saw that one of the people in your press release is fully vaccinated and still contracted it. Is it at all possible, even if you are fully vaccinated, for your immunity to the measles to wear off as time goes on?
We don't generally see waning immunity from measles vaccination. We know that no vaccination offers 100% protection, but the measles vaccine is one of the most effective vaccines that we have available. And in fact, for about 97% of people who receive
4:30s by the time we reach midnight. We're also looking ahead towards, of course, your New Year's forecast as we look.
Sorry, let me mute myself if that's me.
Okay. Yeah, just wanted to continue with that, to let people know that the measles vaccine is one of the most effective that we know of. And in fact, about 97% of the people who get the recommended 2-dose schedule will have lifelong immunity. So it's not a question of waning immunity. It's just that a small percentage of people actually don't respond. But as I mentioned earlier, it offers great protection because 99% of our cases for whom we have vaccination status are unvaccinated. And that tells us about the protection that the measles vaccine offers.
Thank you, Dr. Bell. Aria?
Hi there, this is Aria Bendix with NBC News. Linda, how would you characterize where we are in the trajectory of this outbreak? Would we say cases are still rapidly accelerating? And what does this mean for the country's elimination status for measles?
Well, it's difficult to say where we are in the trajectory in South Carolina because, as I mentioned, we have over 200 people now in quarantine. And the latest date that quarantine ends for those currently in quarantine is January the 21st. So based on our experience throughout this outbreak, we know that a large number of our cases are those who we've placed in quarantine because of known exposures. This would include these 200 plus people that we've mentioned. So we can anticipate that we will continue to see additional cases for those who are now in quarantine. And unfortunately, around each new case, we continue to see transmission in households primarily. I would say over 40% of our cases are a result of household transmission. We are seeing continued transmission in our schools. We are seeing continued transmission as a result of exposures in the churches. So the trajectory that we're looking at now is that we do anticipate more cases well into January. What that means for us nationally in terms of how they are defining our designation in this country as having eliminated measles is unclear, because some outbreaks in other jurisdictions have been declared over. So whether or not that's being defined as continuous and ongoing spread or transmission in this country has yet to be defined.
Thanks, Dr. Bell. And Baker?
Hey, it's Baker Maltsby with the Spartanburg Herald Journal. Wanted to know if the new cases that
and that's what we have right now. And again, this honor the lives lost in that tragic plane crash involving NASCAR great Greg Biffle, his family, and the others that were on board.
Hey, we good?
Sorry about that, folks. As a reminder, if you will, please mute yourself if you're not asking a question. That'd be helpful.
All right, so that was an update from South Carolina health officials regarding the measles outbreak. All right, let's take a quick break. We'll be back here in just 2 minutes here on Live Impact News on WCNC Plus.